Welcome to week 4 of medical terminology. This week, chapter 8 covers hematology and chapter 9 covers immunology. For chapter 8, you're going to want to be able to describe the medical specialty of hematology, understand the functions of blood, define hematology-related combining forms, prefixes, and suffixes, identify the components of blood, build hematology medical terms from word parts, explain hematology medical terms, and use hematology abbreviations. Briefly, as we introduce you to hematology, you should know that hematology is the study of blood. It involves the diagnosis and treatment of disorders of the blood and blood-forming tissues. Hematologists treat bleeding disorders, cancers of the blood-forming tissues, and anemia. They also interpret blood tests and understand transfusion science. The blood has multiple components. 55% of the blood is made of a watery substance called plasma, and in the plasma you'll have glucose, amino acids, and hormones that are transported by the plasma to different tissues of your body. And you're also going to be able to find electrolytes. The other 45% of your blood is called the formed elements. And there are 3 types of formed elements: erythrocytes, leukocytes, and platelets. The formed elements are created through a process called hematopoiesis. Erythrocytes are what we would call red blood cells, and they contain a molecule called hemoglobin. Hemoglobin is an oxygen transporting protein, and it's what gives erythrocytes their red color. People experience fatigue when they have not enough hemoglobin because that means too little oxygen is being transported and delivered to tissues. Extreme cases of this can lead to coma or death. Leukocytes are commonly called white blood cells, and they're very important in defense against diseases. There are 5 types of leukocytes: neutrophils, lymphocytes, eosinophils, monocytes, and basophils. And sometimes it's hard to remember all the different types of leukocytes, but I usually tell my students, remember the phrase, never let monkeys eat bananas, or NLEMB, and that'll help you remember the names of the different types of leukocytes. Platelets are the last type of formed element, and sometimes they're called thrombocytes. They're actually fragments of larger cells, and they facilitate the blood clotting process known as hemostasis. The following list presents combining forms closely associated with blood and used for building and defining hematology terms. Baso, base. Coagulo means clotting. Eosino, rosy or red. Erythro, red. Hemo or hemato refers to blood. Leuco refers to white. Lympho, lymph. Neutro refers to neutral, and thrombo would be clot. These combining forms are not specific to hematology, but are also used for building and defining hematology terms. Cyto, cell. Embolo, plug. Glyco, sugar. Lipo, fat. Myelo, bone marrow. Patho, disease. Phlebo, vein, and septic, infection. I introduced these suffixes in chapter 2, but let's review them because they're used to build hematology terms. Cyte, cell. Cytosis, abnormal cell condition. Ectomy, surgical removal. Emia, blood condition. Globin, protein. Ea, condition. Ik, pertaining to. Logist, one who studies. Logi, study. Lysis, to destroy. Lytic, destruction. Meter, instrument for measuring. Metry, process of measuring. Oma is a mass. Osis is an abnormal condition, and otomy is cutting into. Penia, too few. Phil, attracted to. Plasm, formation. Poesis, formation. Reg is abnormal flow. Stasis, stopping, and tic, pertaining to. And let's review these prefixes that we learned in chapter 3 because they're also used to build hematology terms. A, without, and without. Anti, against. Auto, self. Hyper, excessive. Hypo, below, insufficient. Mono, one. Pan, all. Poly, many. Trans, across. Open your book to page 137 if you have the 3rd edition, and work through building hematology terms on your own. and then come back to this section on the video and we'll review a sampling of the terms here. Let me remind you that word parts are divided with slashes in the book. So pause and then return when you're done with this section. Okay, let's see how you did. Cyte is a suffix that means cell. Build a term meaning red cell. Erythrocyte, clotting cell, thrombocyte. Cytosis is a suffix meaning abnormal cell condition or too many cells. Build a term meaning abnormal condition in white cells. Leukocytosis. Anemia is a suffix meaning blood condition. Anemia is a condition of being without blood. Hyperglycemia is a blood condition with excessive sugar. Hemo is a combining form meaning blood. Hemocyte is a blood cell. Hemoglobin is a blood protein. Hemato is another combining form meaning blood. Hematology, study of blood. Hematoma, a blood mass. Hematocytopenia, too few blood cells. Penia means too few. Pancytopenia, too few of all cells. Neutropenia, too few neutral cells. Phil is a suffix meaning attracted to. A basophil is a type of white blood cell that's attracted to a basic stain. Recall that you also have neutrophils and eosinophils. Poiesis is a suffix meaning formation. Thrombopoiesis is formation of clotting cells. Thrombo is a combining form that means clot. Thrombolysis is to destroy a clot. All right, I hope that was helpful and you were able to build all those terms. Now let's go through some hematology vocabulary. Anemia is a group of blood disorders involving either a reduction in the number of circulating erythrocytes or the amount of hemoglobin in red blood cells. The result of this is that there's a decrease in oxygen that's delivered to tissues. An anticoagulant is any substance that prevents blood clot formation. And aplastic anemia is a type of anemia caused by loss of functioning red bone marrow. It results in the decrease of number of all of the blood cells, and it may require a bone marrow transplant. Autotransfusion is the process of collecting and storing one's own blood to replace blood lost during surgery. A blood analyzer is a machine that automatically performs multiple blood chemistry tests, such as complete blood cell count, erythrocyte sedimentation rate, and blood clotting tests. Blood culture insensitivity, also called CNS, is a blood specimen is incubated to check for bacterial growth. If bacteria are present, they are identified and the best antibiotic treatment is determined. Blood transfusion is the transfer of blood from one person to another. Bone marrow aspiration is the removal of a small sample of bone marrow by a needle for examination for diseases such as leukemia or aplastic anemia. Bone marrow transplant, abbreviated BMT, is a process when patients receive red bone marrow donation after his or her own bone marrow is destroyed by radiation or chemotherapy. To coagulate is to form a blood clot. Complete blood cell count, called a CBC, is a comprehensive blood test that includes red blood cell count, white blood cell count, hemoglobin, hematocrit, white blood cell differential, and platelet count. An embolus, commonly called a floating clot, is usually a piece of a thrombus that breaks away and floats through the bloodstream until it lodges in a smaller blood vessel and blocks blood flow. Erythrocyte sedimentation rate, abbreviated ESR, also called SED rate, is a blood test that measures the rate at which red blood cells settle out of blood to form sediment in the bottom of a test tube, and it indicates the presence of an inflammatory disease. Hematocrit, abbreviated HCT, is a blood test that measures the volume of red blood cells within the total volume of blood. A hematoma is a collection of blood under the skin as a result of blood escaping into tissue from a damaged blood vessel. This is commonly called a bruise. Hemoglobin, abbreviated HGB or just HB, is a blood test that measures the amount of hemoglobin present in a given volume of blood. Hemophilia is an inherent lack of vital clotting factor that results in an almost incomplete ability to stop bleeding. And iron deficient anemia is anemia that results when there's not enough iron to build hemoglobin for red blood cells. Leukemia is a cancer of leukocyte-forming red bone marrow, or the red bone marrow that forms white blood cells. The patient has a large number of abnormal and immature leukocytes circulating in the blood. Pernicious anemia, abbreviated PA, is an anemia resulting when the digestive system absorbs an insufficient amount of vitamin B12. This vitamin is necessary for erythrocyte production. And remember, erythrocytes are your red blood cells. Phlebotomy is the removal of blood specimen from a vein for laboratory tests, also called a venipuncture. Platelet count is a blood test that determines the number of platelets in a given volume of blood. Polycythemia vera is a condition characterized by too many erythrocytes. The blood becomes too thick to easily flow through the blood vessels. Prothrombin time, or ProTime, or PT, is a blood test that measures how long it takes for a clot to form after prothrombin, a blood clotting protein, is activated. And this is a naturally occurring protein in your blood. Red blood cell count can be abbreviated RBC, blood test that determines the number of red blood cells in a volume of blood. A decrease may indicate anemia, and an increase may indicate polycythemia vera. Septicemia is the presence of bacteria or the toxins from the bacteria in bloodstream. It's commonly called blood poisoning. And serum is blood that has the formed elements and clotting factors removed. Sickle cell anemia is an inherited blood cell disorder where red blood cells take on an abnormal curved or sickle shape. The cells are fragile and easily damaged, resulting in anemia. This occurs mostly in persons of African descent. Thalassemia is an inherited blood disorder. The body is unable to correctly make hemoglobin, and that results in anemia. Thrombolytic therapy is administering medication to dissolve a blood clot and restore normal circulation. Well, white blood cell count, abbreviated WBC, is a blood test that determines the number of leukocytes in a volume of blood. An increase may indicate infection or leukemia. A decrease may be caused by some diseases, radiation therapy, or chemotherapy. A white blood cell differential, abbreviated DIF, is a blood test that determines the number of each type of white blood cell or leukocyte. All right, let's review some hematology abbreviations. Basal for basophils, BMT, bone marrow, CBC, complete blood cell count, CNS, blood culture and sensitivity, DIF for differential, eosins or EOS for eosinophils, ESR or SED rate is erythrocyte sedimentation rate, HCT or CRIT, it stands for hematocrit, HGB or HB is hemoglobin, LYMPHS stands for lymphocytes, monos, monocytes, PA, pernicious anemia. PMN or polys is polymononuclear neutrophils. PT or ProTime is prothrombin time. RBC stands for red blood cell or red blood cell count. RH plus stands for RH positive, which is the type of antigens that might be present on your blood cells. And RH minus stands for RH negative. SEGS stands for segmented neutrophils. And WBC stands for white blood cell or white blood cell count. That's the end of Chapter 8. Let me remind you to do the practice and review at the end of the chapter. You'll notice that there's case studies, there's a lot of different practice, and help with memorization. And these are really going to be helpful for you when you complete your homework as well as your quiz. Chapter 9 focuses on immunology, and here are your learning objectives for Chapter 9. To describe the medical specialty of immunology, understand the function of the immune and lymphatic systems, define immunology-related combining forms, prefixes, and suffixes, identify the organs treated in immunology, build immunology medical terms from word parts, explain immunology medical terms, and use immunology abbreviations. Immunology is the branch of medicine that diagnoses and treats immune conditions. Immunologists treat immunodeficiency disorders, autoimmune diseases, immune cancers, and allergies. An allergist is an immunologist who specializes in allergy treatment. The immune system is a network of cells, tissues, and organs that protect against pathogens. So what are pathogens? Pathogens include viruses, bacteria, toxins, fungi, and cancerous cells. Many immune functions are carried out by lymphocytes. Lymphocytes are a type of white blood cell, and they're found in lymph nodes, tonsils, the thymus gland, and spleen. The organs treated in immunology are the tonsils, lymphatic vessels, lymph nodes, the spleen, and the thymus gland. Lymph nodes are small, roundish organs that house lymphocytes and other white blood cells. They're located along the path of lymphatic vessels that you see throughout the body. As lymph passes through the lymph nodes, white blood cells in the nodes remove pathogens and damaged cells. The tonsils protect the body from pathogens in the air that we breathe and the food that we eat. There are three sets of tonsils: the palatine tonsils, the pharyngeal tonsils, also known as adenoids, and the lingual tonsils. All three sets are within the throat area. The thymus gland is essential for proper immune function development in early life. It's located in the mediastinum behind the sternum, just above the heart. It begins to shrink during puberty and is replaced by connective tissue in adulthood. The spleen is a large organ that contains leukocytes that filter pathogens from the blood. These cells also destroy worn-out red blood cells. The spleen is located on the upper left side of the abdomen. There are several different types of immunity that can be divided into two broad categories: natural or acquired immunity. Natural immunity is not specific to a particular pathogen. It does not require prior exposure to the pathogen in order to have immunity. However, acquired immunity is the body's response to a specific pathogen. Active immunity develops after exposure to a particular pathogen, whereas passive acquired immunity is the result of receiving a protective substance from another source. So active immunity can be to previous exposure, such as being exposed to the chickenpox while you're a child, or by receiving a chickenpox vaccine. Whereas passive immunity can be from antibodies from the mother conveyed to the infant either through the placenta or the milk, or from another process like antibody infusion. All right, let's review some immunology combining forms. Adenoido refers to adenoids. Immuno is protection or immunity. Lympho refers to lymph. Lymphadeno refers to a lymph node. Lymphagio refers to lymph vessels. Patho, disease. Phago, eating. Spleno, spleen. Thymo refers to the thymus gland, and tonsil refers to tonsil. Here are a few other combining forms that aren't specific to immunology but that will be helpful. Cortico refers to the cortex, cyto, cell, and systemo refers to systems. Okay, and let's again review some suffixes that you learned in Chapter 2. R pertaining to, adic pertaining to, site, cell. Ectasis means dilated. Ectomy, surgical removal. Edema, swelling. Gen, that which produces. Genic, producing. Globulin is a protein. Gram, a recording. Graphy is the process of recording. Iasis, an abnormal condition. Ic, pertaining to. Ist is a specialist. Itis, inflammation. And logis, one who studies. Logees, study of, malacia, abnormal softening, megaly, enlarged, oid, resembling, oma, a tumor or mass, osis, an abnormal condition, pathy, disease, pexy, surgical fixation, plasty, surgical repair, raphy, to suture, stasis, stopping, therapy, treatment, toxic, poison. And let's review some prefixes as well. Anti, against, auto, self, and mono, one. Okay, are you ready to build immunology terms? If you have the third edition, open your book to page 157 and start working through those terms. Pause here, and when you're done, come back and we'll work through a sampling of them together. Okay, let's see how you did. Adenoido is a combining form that means adenoid. To build a term meaning inflammation of adenoids would be adenoiditis. Immuno is a combining form that means protection or immunity. One who studies immunity is an immunologist. Producing protection is immunogenic. A lymph tumor is lymphoma, lymph swelling, lymphedema, stopping lymph, lymphostasis. Lymphadeno is a combining form that means lymph node. Lymphadenopathy is a disease of lymph nodes. Lymphadenogram is a record of lymph nodes. Lymphangio is a combining form that means lymph vessel. To build a term that means dilated lymph vessel would be lymphangiectasis. Surgical repair of a lymph vessel, lymphangioplasty. Patho is a combining form that means disease. Disease producing, pathogenic. One who studies disease, pathologist. Phago is a combining form that means eating. An eating cell is a phagocyte. Spleno is a combining form that means spleen. A term that means resembling the spleen is splenoid. An enlarged spleen is splenomegaly. And surgical repair of the spleen is splenopexy. Thymo is a combining form that means thymus gland. To build a term that means thymus gland tumor would be thymoma. Tonsillo is a combining form that means tonsil. To build a term that means tonsil inflammation is tonsillitis. So let's review some immunology vocabulary, and let me encourage you to follow along with me in your textbook because there's some great pictures and additional explanations there. AIDS-related complex is the early stage of human immunodeficiency virus, HIV infection, in which mild symptoms of infection are present, including lymphadenopathy, fatigue, fever, night sweats, weight loss, and diarrhea. Acquired immunodeficiency syndrome, AIDS, is a later stage of HIV infection when the cells lose their immune system, or the cells of the immune system lose their ability to fight off infections, and patients become unable to resist opportunistic infections such as pneumocystis pneumonia, PCP, and Kaposi's sarcoma. An allergist is a physician specializing in diagnosis and treatment of allergies. An allergy is a hypersensitivity to a common substance in the environment, such as pollen or food or medication. Anaphylactic shock is a life-threatening condition resulting from a severe allergic reaction causing cardiovascular and respiratory problems, and it might be triggered by an insect bite or sting, some medications, or certain foods. It's also called anaphylaxis. An antibody, some lymphocytes respond to the presence of an antigen by producing antibodies, molecules, not cells, that combine with antigens to form what's known as an antigen-antibody complex. And what these complexes do is they prevent pathogens, such as viruses or bacteria, from being able to damage healthy cells, and then they target those cells for phagocytosis. And if you recall, phagocytosis means the process of eating other cells. An antigen is a protein that's foreign to the body that produces an immune response. These proteins are present on the cell membrane of bacteria, or they might be visible in viruses. An antihistamine is a medication that blocks the effect of histamine that's released from the body during an allergic reaction. Antinuclear antibody titer, abbreviated ANA. This is a blood test that determines the number of antibodies against cell nuclei present in the bloodstream, and it's elevated in autoimmune conditions. So what is an autoimmune disease or condition? It's a disease that results from the body's immune cells attacking its own cells as if they were pathogens. Some examples might be multiple sclerosis, lupus, sarcoidosis. Corticosteroids are hormones that are produced by the adrenal cortex. So you have adrenal glands that sit atop your kidneys, and the cortex is the area surrounding those adrenal glands. And they're used to treat autoimmune diseases due to their very strong anti-inflammatory properties. Cytotoxic cells are cells of the immune system that are capable of physically attacking and killing pathogens or disease cells. Elephantitis results from the blockage of lymphatic vessels, and this causes extreme tissue edema. HIV antigen and/or antibody immunoassay is a blood test for the HIV antigens and antibodies. Antigens can be detected very shortly after infections, and then antibodies tend to appear 2 to 8 weeks after someone's infected with HIV. An antibody-only test can be performed using saliva. Hives are a common name for the appearance of wheals during an allergic reaction. Hodgkin's disease, abbreviated HD, is the cancer of lymphatic vessels that's found in the lymph nodes. It's also called Hodgkin's lymphoma. Immunodeficiency is having an immune system that's unable to respond properly to pathogens. Someone who has an immunodeficiency is also called immunocompromised. An immunosuppressant is a medication used to block certain actions of the immune system. It's used to prevent rejection of transplanted organs as well. So people who have an organ transplant usually take immunosuppressants most of their lives, so they would be considered immunocompromised individuals. Inflammation is a tissue response to injury characterized by redness, pain, swelling, and feeling hot to the touch. Kaposi sarcoma, abbreviated KS, is a type of skin cancer often seen in patients with AIDS, and it consists of brownish purple papules that begin in the skin and spread to the internal organs. Mononucleosis is an acute viral infection of lymphoid tissue with large number of abnormal white blood cells that circulate in the bloodstream. Non-Hodgkin's lymphoma, abbreviated NHL, is a cancer of lymphatic tissues that's different from Hodgkin's lymphoma. A nosocomial infection is one that's a result of hospital exposure. It's also called a healthcare-associated infection, HAI. Opportunistic infections are seen in patients with compromised immune system, and pneumocystis pneumonia, or PCP, is an opportunistic infection common in immunodeficient people caused by a fungus called Pneumocystis jirovecii. Sarcoidosis is an autoimmune disease with fibrous lesions forming in lymph nodes, liver, skin, lungs, spleen, eyes, and small bones of the hands and feet. A scratch test is a type of allergy test in which the body is exposed to allergens through a light scratch in the skin. Severe combined immunodeficiency, called SCID, is a genetic condition of children born with a non-functioning immune system, and these children are often forced to live in sealed, sterile rooms. Systemic lupus erythematosus is an autoimmune disease in which the immune system attacks connective tissue throughout the body, such as joints and the skin. Urticaria is severe itching associated with hives, usually seen in allergic reactions to food, stress, or medication. A vaccination is an exposure to a weakened pathogen to stimulate an immune response, and this causes antibody production in the body to give future protection against the full-blown disease. It's also called an immunization. All right, let's review some immunology abbreviations. AIDS, acquired immunodeficiency syndrome, ANA, anti-nuclear antibody titer, ARC, AIDS-related complex, HAI, healthcare-associated infection, Hodgkin's lymphoma, HD, HIV, human immunodeficiency virus. IG stands for immunoglobulins, and there are multiple types of them: IgA, IgD, IgE, IgG, and IgM. KS stands for Kaposi sarcoma, mononucleosis, mono, NHL, non-Hodgkin's lymphoma. PCP, pneumocystis, pneumonia, SCID, severe combined immunodeficiency, SLE, systemic lupus erythematosus, TNA, tonsillectomy, and adenoidectomy. All right, students, that's the end of Chapter 9. Let me encourage you to complete the practice and review beginning on page 167, and do that before you start your homework